Hello friends, I am Dr. Sandeep Bhasin from Cortical Medical Center. So in this series of rhinoplasty today, I'm going to talk to you what basic tests need to be done before we go for a rhinoplasty. So friends, rhinoplasty can be done for two reasons. One is for improving the shape, which is called the aesthetic rhinoplasty. And other is if there is some problem in breathing, then it is called functional rhinoplasty. Now, what investigation should be done, what evaluation should be done before we go for rhinoplasty? So first very important thing that we have to do before we go for rhinoplasty is we have to look the nose from inside by an endoscopy or by nasal speculum to look if there's any blockage in the nose, any polyp in the nose, hypertrophy of turbinate, blockage of internal walls, anything that is blocking the nasal passageway, which we need to correct when we do the surgery. The other thing that we can do is the CT scan of the nose to find out if there is a major problem in the nose structures. There is sinusitis, hypertrophy of the turbinate, concha is there. These things have to be always seen in the CT scan. There are few investigations we can do if there is a breathing problem along with it. We want to improve the shape and there is a breathing problem. One common test is called the Cottles Test, which basically means if the person has a breathing difficulty and we lift the cheek up, they are able to breathe better. The other test that we do is called the tip recoil test, and in this we press the tip of the nose with the finger. If the tip comes back, bounce back normally, this is the normal, but if it doesn't bounce back, that means the cartilage is very weak or deficient. If the cartilage is deficient, we need to replace it by some cartilage that we can take either from the rib or from the ear, or that is called the concha cartilage. Now friends, understand the nose has two structures to support it. The upper 1/3 of the nose is bony, that nasal bone. The lower 2/3 is cartilaginous. Cartilage is a structure which is harder than the normal tissues but softer than the bone. A cartilage will give us support if it not to the tissues and skin. If you press it, it will get compressed but it will recoil back. This is a cartilaginous structure. So whenever this cartilage becomes deficient in the nose will become either droopy tip or it will cause depressed nose or other problems. Then we need to strengthen this cartilage. We can strengthen this cartilage either with a silicone implant or we can use a graft from somewhere in the body, either from the ear, that is called concha cartilage, or from the rib, that is called the rib cartilage. Now, very important thing, if you're going for a rhinoplasty, please avoid using silicone implants, because whenever silicone implants are used, they either get infected or deviated, or they change their position, or they cause problems after 2-3 years. So there are a lot of problems with silicone implants when we're using these foreign bodies in the nose and putting them, and they cause problems. In our setup, we never use these implants unless there is no other choice or the patient is willing for them. Even when we are telling them they just want the implants to be used, then that's a different thing. But from our side, we always tell not to use these implants. So friends, this is what I like to say in this video. Thank you. I'm Dr. Sandeep Bhasin from Cortical Medical Center.